Hi there. In the history of epidemics, lessons learned from each other from each episode have improved people's awareness of public health and the capacity to counter challenges. The fight against the novel coronavirus has entered a critical time in China, and the second separate wave of influenza has hit the United States of America. So what has been learned from the coronavirus outbreak so far? What are the different approaches taken by China and the U.S. in dealing with the epidemics? And how is China's capacity to counter epidemic threats developing? To discuss these issues and more, I'm joined via satellite by James Chow, World Health Organization Goodwill Ambassador, also a host of the China Current in Hong Kong, and Mariel Cavallo, founder and CEO of M Communications Group in Shenyang. I'll also talk via Skype to Professor Andrew Miskar, head of the Department of Biochemistry at Purdue University. That's our topic. This is a dialogue. I'm Yang Ray. Welcome to Dialogue. First of all, James, what can you tell us about the interactions between you and the WHO in terms of the global impact of the novel coronavirus?
Thanks very much, Yang Ray. Well, I just got off the phone with the chief scientist of WHO, Dr. Soumya Swaminathan, and she confirmed that they still don't know the full epidemiology of this virus. They do know that there is a connection to bats, for example, in what appears to be southern China, but they can't make the link yet from whether it jumps straight to human transmission or whether it passed through an intermediary animal in between. And understanding that is going to be critical before they can move on to vaccines and before they can move on to the human trials of that. In the meantime, they're working very intensely, not only on the research, but in parallel, we're seeing whether existing therapies, for example, antiretroviral therapies that are going into trial in Japan, as we know, or whether any therapies currently being used for Ebola can be effective treatments for people in China. The point, she says, is to try and save lives now, and the vaccine will come later, but that has to be at a later stage.
A very simple question, very quickly, James. Why is the epidemic called COVID-19 instead of linking it to the names of a Chinese city or the country itself?
Well, there was an absolutely clear decision around that. First of all, there are protocols, as you know, around naming diseases, but where WHO came in very strongly is that there has been a tradition in the past of naming diseases after cities or towns or countries or areas where they appear to have originated, be it the Spanish flu or more recently MERS, the Middle East respiratory syndrome. But WHO is very sensitive to the fact that there is a lot of stigmatization between this COVID-19 and the people of Wuhan, and in fact not only just Chinese people but people who appear to be of East Asian descent. We've heard a lot about race-based attacks or racial profiling all around the world that have nothing to do with people with travel history to mainland China. So COVID, meaning coronavirus disease, and this is number 19 for now, but very much a step away from Wuhan or China or any connection to this region because of the stigma.
Thank you very much. Let me cross over to Mariel, who's standing by in Shenyang. What do you make of the alleged stigmatization of a certain country, like Beijing flu, China viral? I mean, this kind of things emerge quickly on the media, particularly the media in the West. Do you think this is a deliberate effort to discredit a country or a city? What do you think of the impact of such a move? Mariel?
Yang Ray, far beyond this virus outbreak situation, you bet it's intentional. It's been intentional for well over a decade on the part of particular Western mainstream media to demonize China and to demonize them with every opportunity that they possibly can. The part about the situation that's so disturbing this time, which led to the tremendous response to the article that I wrote, was the fact that here we are in a human tragedy. So we're not even discussing a political topic like a business forum or an economic forum or, you know, a trade war. It's not that topic. It's human tragedy. And even when it's human tragedy, did these particular Western media Did they lighten up? Did they change their tune to show more compassion, to show more caring, to show more love? No, not at all. They went ahead and continued politicizing it, and honestly, it's a disgrace. And so many people across the world feel that exactly the same way. And we're sick of it. It's gone on for way too long, and it's probably going to continue, unfortunately.
And probably WHO does represent the most authoritative voice concerning the nature and the impact of the COVID-19 or epidemic that broke out in Wuhan, Hubei province. Let me get to Andrew. Andrew, according to Mi Feng, spokesperson for the National Health Commission in Beijing, the proportion of critical coronavirus patients among confirmed cases has decreased significantly in China, including in Hubei province. And by the way, Maria, who's standing by in Shenyang, capital city of Liaoning province in northeastern China, said obviously there's almost a zero increase of confirmed cases in that province. So what do you make of the latest development?
Well, I mean, I hope, not being on the ground, I can't comment exactly what's happening. My hope is that we've seen an inflection point, or at least nearing that at this point, and that it will continue to decrease. And so that will be a good sign for the entire world if that's indeed happening and the spread is beginning to diminish.
In your analysis, Andrew, what effect have the coronavirus controls implemented by China had? And what's your take on China's management of the current coronavirus outbreak?
Well, first off, you have to understand, I'm in the United States, so I'm watching all this on any media outlet that I can get. But my first response just a few weeks ago was that China was taking extraordinary measures to control the spread of the virus. They were working hard and amazingly to create hospitals essentially within weeks in order to treat patients. And I've never seen anything like that in the United States. So I can only comment that it was extraordinary measures from my point of view. And so I'm impressed.
Thank you very much. Let me go back to James Shao. Perhaps we are seeing the end of the beginning or beginning of the end game, because on phase 2 or 3, James, a lot in mainland China start to complain. Well, all of these stories may have been overblown, and there are allegations that we have acted excessively to counter the challenges. Now, what do you think of the grievances of the ordinary folks here?
Well, I think it's very hard to be in self-confinement or impose quarantine if you are in Wuhan or one of those cities nearby that are in lockdown, because we have to empathize with the people that this is not only a physical measure, but it's one that's having enormous impact on their mental health. After all, being confined to a certain space, being told that you can't go out, even if it's for their good health. And I think naturally, people will begin to see where they can apportion blame for this. But I think, as Mario said just then, the really important thing right now is to recognize that there's a job at hand. Dr. Tedros has stressed this a number of times. He's been asked whether he gave China overt praise, for example. But I think the important point here, and knowing a bit of his personality working with him, is that there's a job here to be done. It is a human tragedy, as was described earlier. It is a human crisis. And I think this is a time where we see people coming together, not only here in China, but I think it should require it around the world. What's been very interesting for me as an impartial observer is to see that when you have a hurricane or when you have a tsunami, when you have an earthquake somewhere around the world, there's usually an outpouring of reaction, especially if it's happening in a developing country. But when you see it here with China, there's been a very different reaction, almost as if the coronavirus is your fault, it came from you, and therefore you figure it out. And I think that's where global solidarity, as Dr. Tedros has said many times, is important, that we collaborate not only in science, but we collaborate across compassion as well. This
yes,
is
indeed, compassion
human
is the
crisis
word,
first and
particularly
foremost.
when the bushfire starts to engulf many more parts of Australia. You seldom hear any criticism about the poor governance, quote-unquote, by the Australian government. By the way, James, China has established a developed health system in the past years. The outbreak of the COVID-19 in Wuhan has become a test for China's governance. In which areas does China need to improve its epidemic control and prevention capacity? What are the priorities to guarantee the health and the well-being of medical staff in particular? They are also very human.
Well, exactly, and I think that they're the heroes of this story, not because they're Chinese health workers, but because they're health workers, and many of them have chosen to go to the areas. Many of them are not from Wuhan. That's what we knew in the beginning, but many of them have, as you know, Young Ray, have come in from their own hometowns and chosen to leave the relative safety of their homes, and especially of their own young families. Those photographs, those videos that are appearing on social media are very distressing for all of us to see, but also a reminder of health workers that when they take that Hippocratic oath, they really put their own lives first on the front lines. And when we look at this as a whole, what we need to do is really better understand the prevention and what are the best ways to prevent the transmission of infection. We don't know the full ways of that yet. We do know, though, that there is a shortage of basic preventative gear available in mainland China, masks being one of them, but suits and gloves being another. So I think that in terms of looking at that picture as a whole, we must look at our health workers as our most precious resource. And for China in strengthening its own healthcare system is very different from when I first moved to Beijing about 20 years ago almost. I think scale is always the issue. It's not the go-to answer for everything, but when you're talking about 1.4 billion people, I think a lot of people are staggered that over 50 million people are in lockdown, and that's only one relatively small part of the country, that it gives you a kind of scope and understanding of the challenges that China really faces today.
Medical workers and volunteers from NGOs around the world tend to be the first casualty in such tragic cases like the humanitarian crisis, and they absolutely command our respect, by the way. Let me get back to Mariel. What does this mean? I mean, the disease control and prevention at this stage. What does that mean for modernizing China's governance capacity, looking back in our hindsight, wisdom, especially at local level in related emergency response system? Mariel?
Well, Yang Rui, let's look at the result that has happened. The emergency response that has been put into place didn't even exist literally 2 or 3 weeks ago. It's so remarkable how fast it was put into place. And I'm happy to share with everyone tonight essentially what I would regard as breaking news. I'm aware of cities all over China, and I'll speak specifically about where I am on the ground. As Andrew was just saying, he's not here, he doesn't know, and I'm happy to share it with him. We're on the ground here in Shenyang, and we've already beaten the virus. Okay. I mean, isn't that incredible? The Shenyang government has issued back-to-work orders with 17 guidelines to get back to work. There's been no new cases of the virus in a week here in Shenyang. There's been no new cases of the virus in Jilin in 2 weeks. There's been no cases of the virus whatsoever in Fushun. So I can only speak to this city. I'll speak just to Shenyang. I'm saying to you that there's no new cases. There hasn't been. And so we're past it and getting back to work. Now, that's a testament to the comments that the other gentlemen have both made, this incredibly broad, unprecedented, groundbreaking response that has come together from the provincial governments through to the cooperation of dutiful people, everyone willing, including myself, my wife, my son. My boy hasn't been in school for 3 weeks. You know, we're home, we're hunkered down. Everyone is doing it, and guess what? Now we have a message to the world, because this is going to be a government sovereign emergency response to global pandemic threat case study. That's what this is going to be. And I'm going to say it right now. The media that has been demonizing China, they're going to start reporting that other countries, including America, are going to look at this case study and what China did, and they're going to adopt what we did. So, how badly did China do, Yang Rui? We did tremendously well because we won. The joy of spring is here. We're going back to work. It's only been 2 weeks. So this idea of, and I can think about what the WHO has to say about these measures. What did we do? We said to everyone, stop school, stop business, go home and stay home. And the only thing you could do, and the only thing there was to do, because all the businesses were closed, was go to the grocery store every couple of days and buy yourself some food. That's all we did for the last 2.5 weeks.
We
now,
do appreciate the resumption of confidence of local residents in Shenyang. You know, you are pretty lucky. You are kept alive by the current government in Shenyang, and they certainly deserve credit for the nice governance, not under the leadership of the former mayor, Mu Suixin, whom I interviewed, who had been found guilty on charges of corruption, and he died behind the bars, by the way. Let me get back to Andrew. Andrew, according to the latest report from the Centers for Disease Control and Prevention, the CDC, 92 children died in the U.S. as of February 8th, or week 6 of the official flu season. Among the 92 deaths, 30 were caused by influenza A, and the remaining caused by influenza B. Influenza B mostly affects children and young adults, while influenza A is more common in those over 20 years old. So the CDC said the reason for a spike in pediatric deaths is that 2 strains of the flu that are tough on children are spreading in the same season. How are U.S. health officials reacting to the second wave of flu, and how does the threat from H1N1, which critically broke out in the United States, compare with that?
Well, I can kind of start off here by saying that last week I spent 4 days sick from the flu. I didn't get my flu shot this year, so I'm letting you know that's, I'm just coming off of that myself. I think, I like to tell my students, I like to tell others to put in perspective that the flu in the United States, we're going to have over 150,000 people hospitalized, right? 15 to 20,000 individuals will die. Obviously, I mentioned children, which is a tragedy also. This is real, but around us. I've had schools that have shut down locally here in Indiana because of the number of children in elementary school that have had the flu. So they just basically said, we're shutting down the schools, there's not enough kids here. So this is what we're living in almost every season here in the United States. We have more of a nonchalant attitude about it. It's in our population. We have vaccines, we have antivirals, so we tend to take it's just the flu type of attitude. But yet there are a number of people dying each year. I think it's because we have the ability to treat flu. We have the ability to prevent flu through vaccinations. And although I didn't take one because it's just something that escaped me this year. So I always think about that when I'm thinking about coronaviruses. I mean, coronaviruses around us. They're going to be around us. They've been around us for decades, all right? So this is not something that's going to leave. It's something that's going to be with us from now and throughout humanity. It's just a natural process. It's unfortunate that it happened in China. They should not be demonized. It's just what these things happen. It's globally, we are in a situation where we are going to, the whole world will come. I will continue my research. I've been doing research on SARS since the SARS outbreak. I've never stopped, although funding went way down. We continue to work on our antivirals. So going back to the flu, it's a lot easier for us to accept a disease that's normal in our world when we have the ability to treat with very good vaccines and antivirals. We just don't have those for coronaviruses. If we had that with coronaviruses now and we knew what to do, things would be markedly different, especially when you consider the overall numbers of individuals involved.
Well, Andrew, I have a little bit of doubt, and I have the benefit of doubt as to your capacity and ability to cure patients of influenza A or B, despite the impact of and the usefulness of your vaccines. You're going to see many infant mortalities, and the rate of fatalities could also be there. It shouldn't be underestimated. So, are you worried that there are going to be more deaths?
Well, yeah, I'm always worried about that, and we will likely have some more. It's a bad flu season compared to some of the other ones that we've had in the past, and it's not as bad as others. So I think, we need to do due diligence. Like I said, I didn't get vaccinated. It was nonchalant about it. But I know that it's a risk every year. I think compliance is an issue when it comes to diseases like this. Individuals just think it'll be okay, or I'll ride out the 3 or 4 days. Infants don't have that choice. Children don't have that choice. They need parents and guardians to take care of them, and that doesn't always happen.
What we notice here in China is that the deaths above the age of 50 rise very rapidly, and particularly most of the deaths occurred above the age of 80. That has a lot to do with the basic diseases that they already have before getting contracted. Let me ask you, how do you, Andrew, how do you compare the similarities and differences between China and the US in dealing with the epidemic, including the COVID-19 and the influenza?
Hell, it may be a little bit difficult for me to compare directly by not being on the ground in China and also not being a healthcare worker. I'm more on the research stage, so maybe my WHO colleagues here could comment more on that.
Okay, thank you very much. Let me go back to James for his comments. James, what can be learned from both in terms of public health emergency cooperation?
Well, back in September in New York, on the sidelines of the General Assembly, I was one person of many people who was involved in the first report of the Global Preparedness Monitoring Board. That's led by Gro Harlem Brundtland, who is a former Norwegian Prime Minister and a former WHO Director General, and Asi, who is the new head of the Kofi Annan Foundation. And they warned very clearly at that time, and they're not by any means the only people who have said this. They warned very clearly that the world is at acute risk of disease epidemics and pandemics that are going to upend economies, that are going to create social chaos. And nobody really listened. There were some pretty authoritative articles and media coverage from that launch, but I think I can fairly say that the media coverage was a lot lower than what it is today. Now you see everybody panicking, saying, why didn't they declare a global health emergency? Why didn't we know about this further? Whereas people like Andrew over at Purdue have been working diligently over the last 20 years on SARS, for example. There are people in the scientific and the health community who are doing all of this. But in terms of government leadership and in terms of media support, there has been a real drop-off. You'll see it after this in a few weeks' time, if hopefully this begins to subside. The world, in terms of its focus, will begin to move on to something else. Not you, Young Ray, or your program, but I'm sure many other people in the media industry. And so to come at this time and to apply pressure to organizations right now, whereas I think what they need is support more than anything, rather than criticism, is a little bit galling sometimes when you look at the overall picture.
I wonder if this is a theory of a self-fulfilling prophecy, James. Some ugly stories start to emerge as to what could have happened at the P4 laboratory based in Wuhan. You know the importance of this laboratory, and there have been allegations, nasty allegations, about the leaks and the trading of wild animals that are, taken out of the laboratory in Wuhan. What do you think of this conspiracy theory, quote unquote?
I'm not going to refer specifically to the details of that theory because I think it's so demeaning to the people on the front lines of the health response effort right now that even I get it, even from close contacts of mine who ask me about its validity or who insist that there's truth in it. It doesn't honor any of the people who have died, who are infected, or who are in lockdown right now in mainland China, or the millions more around the world who may not be Chinese, who are equally worried, and understandably so as well. I think it's cruel. I think all of these theories have come without evidence, and in science is always evidence-based, and I think it goes right to the very heart of what we're dealing with here. It's not just a war against a new virus, but a war against misinformation, against rumor, and in some cases the deliberate dissemination of both. I think it's a very cruel thing for people to do. And unfortunately, we live in a digital age where we have a whole range, a whole plethora of digital platforms and social media platforms at our fingertips, that obviously the ways in which it can come out are far greater than, say, 18 years ago when SARS emerged. There was no Facebook, there was no Twitter. And let's be very clear here, it's not just the media, it's between people, especially on WhatsApp. We see this during election times as well, about how the war on truth is often fought on WhatsApp. But I will add one quick point over here, which is important. WHO reached out a number of weeks ago to a contact that they happened to have at Pinterest, and they said, can you help us to address these rumors by establishing verified and credible sources? Pinterest took it up, Google took it up, Facebook took it up, even on Twitter, where I am in Hong Kong. If I search coronavirus in the search box, instantly I get a box pop up. It says know the facts, and it gives me an option for a local Hong Kong Department of Health source or the World Health Organization. I think at a time when social media giants have come under heavy criticism, this is a time also that we can really say this was a very, very good job done, because we need to engage and work with them on this. And I think on the coronavirus, some of them at least have worked very, very well indeed. And I wonder whether this can now become a template in fighting fake news on other fronts after this outbreak, and not even in health.
There are other strong voices suggesting that the social media should not take all the responsibility. They deserve credit for supervising the conduct of the government, although we have to double efforts to distill information, misinformation in particular, and tell them from the truth. Having said this, let me go back to Mario. Chinese doctors are doing research on how COVID-19 causes organ failure and death while post-mortem examination of dead patients. How important is the post-mortem examination, and what can be learned from these examinations?
Young Ray, I'm definitely going to have to pass on that. I'm not a virologist. I'm not a trained doctor
then
or a medical professional.
Andrew, can you take it over?
Way too technical a question. Yeah.
Sure. So, understanding how the virus spreads throughout the body, human body, into which organs it goes to, tells us a lot about the pathology of the virus. The virus obviously starts in the lungs. We know that very well. But then the fate of the virus afterwards and how it gets into the different organs tells us a lot about the pathology and the types of mechanisms for treatment, for example. We know that if it goes to the liver, it goes to the kidney, it goes to the spleen. This is going to tell us what will happen with organ shutdown, the course of treatment for individuals when we don't have the ability to provide them with an antiviral, or at that point. We have to know this in our research lab. We've studied the mouse hepatitis virus, which is a coronavirus. We've been working on attenuated vaccines. We may find that the virus, when it's attenuated, for instance, the mouse is doing fine, but it ends up in the spleen or accumulates in the spleen. That can tell us a little bit about additional pathology that we'll have to combat later on. So it is important to know what's happening with the individuals, their ages, and how the virus actually spreads. Things like cytokine storms, which result from the viral infections. These are the types of things that actually and ultimately can lead to death. So it's an important scientific need that we have for moving forward with learning how to best treat patients infected with coronaviruses.
Thank you so much, Andrew. And obviously, despite the very decent comments by James Chow on the alleged leaks of wild animals from P4 laboratory, the U.S. Centers for Disease Control and Prevention took action in August 2014 to improve laboratory safety following incidents in which research fellows failed to process viral samples properly. Well, that's a wake-up call from SARS to Ebola, MERS to the current COVID-19 is part of the learning curve for the international society to fight jointly and to work in partnership to ensure early prevention and control of epidemics. I'll see you next time. Goodbye.